was also expressed concern about the emergence, as we have heard, of falsified and substandard vaccines, which have been rumored to be in circulation, which again give reason for concern. Where there's so much demand and supply is low, the criminals can get to work. So we have to be quite aware of that. Here in Nigeria, we have made it very clear that the use of the vaccines will not mean the end of other measures, the non-pharmaceutical measures, the public health measures that we are taking. We stick very much to them. We are going to continue prioritizing them as if the vaccine were not a solution until we get to the level of 60% minimum that we want to get to for coverage.
Thank you very much for those final remarks. That's really.
Can I just, Mr. Moni, can I just say one point of thing?
Of course.
And that is to say that the way that Africa has worked together on this particular issue, the cooperation, the continental cooperation that has been there, not just individual countries, but with the individual countries themselves. I think something to be proud of. But I think that as we discuss this matter, we need to ask ourselves about how to deal with the immediate issue in the medium term and in the long term as well. Dependency on pharmaceutical products and commodities is one of the issues that Africa must really think about.
Hi panelists, can we have you just speak for, just say hi, hello from your side, just to see if you've got your signals right. Laura, can you start?
Hello, 1, 2, Laura Buckwell. Hello.
We got that, thank you. Your Excellency, can we have you speak?
Producing their vaccines in South Africa. And if it's a continental-wide market,
Your Excellency.
then it becomes economically.
Yes, sir. Good afternoon, all of you.
My appeal to my colleagues across the continent.
Very well, thank you so much. Okay, Dr. Pascal, can we have you speak, please?
Okay, I'm listening to the other, quite interesting. Thank you.
Thank you very much, Mr. Vardhan.
Yeah, I can hear. It's not 100% clear, maybe because of the panel. I could also listen to the previous panel now, but otherwise I could hear.
Potentially how this.
Correct, yes. That was good, so we are going to put you shortly on stage.
Can His Excellency hear us okay? Did I hear that he was okay hearing us?
Yeah, he can hear you. Your Excellency.
Capabilities to healthcare systems, etc., and generate quite a lot of.
A panel happening, you might be hearing the panel.
Very distinguished panel for a very, very interesting and insightful discussion. We had the Honorable Dr. Osagi.
No worries, this is a different panel. Your panel is starting in a few minutes right now. You should be seeing yourself on stage once you start.
In Kenya, Kashif Khalid, Regional Director, Africa and the Middle East with the International Air Transport Association, David Hanley, CEO of MediClinic, and Bruce Orina, ICRC or Red Cross Head of Delegation and representative to the African Union. We very much hope that you enjoyed the session and found it useful and informative. We look forward to following closely the situation with vaccine rollout in Africa. I hope you enjoy the remainder of the summit and have a very good afternoon.
Thank you to the Honorable Dr. E. Osagi Ihainire, the Honorable Mutai Kagwe, Mr. David Hadley, Mr. Kashif Khalid, and Mr. Bruce Mokaya Oriana. And a thank you to Turlock Mooney for moderating this session. Ladies and gentlemen, our next panel is on vaccine production and distribution across Asia. Humanitarian efforts to deploy shipments of COVID-19 vaccines around the region are well underway, with millions of doses already committed and dispatched. Our final panel for the day will look at the latest developments in vaccine production and the current challenges facing distribution around the region, and how further collaboration and partnership agreements are supporting supply chain performance. With that said, ladies and gentlemen, we invite the panelists of this promising session onto the stage, and they are Dr. Harsh Vardhan, Union Minister for Health and Family Welfare, Science and Technology and Earth Sciences, Chairman, Executive Board, World Health Organization. Mr. Madhav Karup, the Regional CEO of Middle East and South Asia, Hellman Worldwide Logistics. Dr. Pascal Reha, Co-founder and Group Medical Director, International SOS. And the panel moderator is Ms. Laura Buckwell, news anchor and professional MC. Stage is yours.
Well, thank you, Yusuf, for that very kind introduction. Thank you so much to the Hope Consortium and its partners, of course, for creating this essential platform and for having us all here today. Well, a very warm welcome to you all to our next session under the title of Vaccine Production and Distribution Across Asia. And yes, it's the final panel of the two-day Global Summit, where we're going to take a look at the latest developments in vaccine production, the current challenges facing distribution around the region, accessing and supplying remote locations across Asia, and how further collaboration and partnership agreements are supporting supply chain performance. And what a great pleasure it is to have our panelists join us today. Thank you so much for making the time to be a part of this much needed discussion. Well, first and foremost, I'd like to start with His Excellency Dr. Harsh Vardhan, the Union Minister for Health and Family Welfare, Science and Technology, and Earth Sciences for India. He's also the chairman of the executive board at the World Health Organization. A great privilege to have you here with us today. Now, India is home, of course, to the largest vaccine production assets in the world. So how is India scaling up production of COVID-19 vaccines? And how are you working with local and international partners to ensure the timely distribution of these vaccines?
Thank you for posing this to me. You have rightly said that we are, even before COVID, we were helping 60% of the children of the whole world, and particularly the developing world, to have vaccines, and we were supplying 60% of the vaccines to the whole world. And during COVID also, you know, right now we have 2 vaccines in India which have been manufactured in India. One is by the Serum Institute of India, another one is by the Bharat Biotech. These are the Covishield and the Covaxin. And right now we have already a very robust immunization program, which is actually in an reasonably advanced stage in India, whereby every person above the age of 45 will start getting vaccinated from 1st of April. And even today, all the health workers, frontline workers, they have all been vaccinated. And then everybody above 60 years of age and those between 45 and 59, they with comorbidities, they are being given vaccination. But 2 days from now, everybody above 45 will be part of the vaccination campaign. 61 million doses have already been given to Indians, and we have already provided 64 million doses to 84 countries of the whole world. And this is through, you see, some of them are like gifted, contractual, and some of them have been given through the COVAX facility that has been created to help all the countries internationally by the World Health Organization. So as far as India is concerned, we have a very, very clear-cut thinking about the whole issue, and we always feel that the benefits of science, they have to be delivered to the whole of humanity. And that's why even during the crisis of COVID last year, we were at a point of time supplying drugs to almost 150 countries of the whole world. Hydroxychloroquine in the initial stages, we were providing it to 150 countries. And again, for the vaccines also, the process of development of the vaccine, the research around this vaccine was supported very aggressively, proactively by the government of India, and in fact monitored by the Prime Minister himself. And almost 6 months back, I think it was more than 6 months back, we had created the National Expert Group for Vaccine Administration, which has got scientific experts, which has got representation from the whole country of all relevant stakeholders, and it plans each and every nitty-gritty of the vaccine administration. And within the government also, there are multiple departments, multiple ministries working together to ensure that we keep helping the people of the whole world also, and we strike a reasonably good balance between what is the need of the Indian people for the vaccine and also what is needed to be supplied to the rest of the whole world, and more particularly to the countries where they actually deserve more help, because they neither have the manufacturing capacity, neither they have the vaccines. So we are trying to fulfill our commitment which for the rest of the world, which comes from our heart, and our Prime Minister is very ambitiously and very passionately is strengthening the vaccine maitri. We call it vaccine friendship, and through this vaccine maitri, that's the name that we have given to it, we are trying to help everyone all across the world, and we are doing our utmost to in fact strengthen all these capacities within the country, and to see that in the future also, you see right now, apart from these two vaccines which have been given the emergency use authorization, almost half a dozen vaccines in India are in the stages of clinical trials, and over 2 dozen, almost 1 dozen vaccine further, they are in the preclinical trials. So apart from these two vaccines, there is so much happening to strengthen the research around having new vaccines in the near future, also to augment the manufacturing capacity and the ability of the country. And there is a very significant amount of fund which has been dedicated to research around vaccine development, and also to provide vaccine to people in India. A huge amount of fund to the tune of 35,000 crores has been kept in the budget to make sure that the Indian government helps our countrymen to actually get vaccine in time. So we have throughout adopted a whole of government, whole of society approach, and it's now, I think, we are trying to help the whole world also on the COVID front through vaccination abilities of India also. I think that's broadly what answers what you asked me, but if there is anything more that you would like to know, because there are so many aspects of this vaccine administration which have been planned in with so much of meticulous detail. There is a CoWIN platform where we get real data, real time data of everything, every person who gets vaccinated in the whole country, and they at least at 50,000 places in the country, government as well as private, we have the vaccination facilities created where we are in fact following all the minutest possible details, taking all possible precautions, ensuring that every adverse event, if at all it takes place, even if it is a minor side effect, it is taken care of, it is recorded, and it's a huge exercise, humongous exercise, but it has been done in a seamless manner in a country as big as India with a 1.35 billion population.
Thank you so much, Your Excellency, Dr. Harsh Vardhan. A very encouraging update there Thank you so much. Madhav Kurup, the Regional CEO of the MESA region for Hellman Worldwide Logistics. Thanks so much for being with us here today as well. Now, Asia, of course, encompasses a vast and diverse geographic range. So as a logistics company servicing the region over the past year, through border closures, lockdowns, and resource shortages resulting from the pandemic, what have been the most significant challenges, and how have logistics companies such as yours had to adapt their approaches to keep supply chains moving there?
And thank you, Laura, first of all, for having me in such a distinguished panel here. Yeah, of course, it goes without saying that none of us was prepared for a pandemic like this. And that has thrown us into the middle of a crisis. And for example, airline capacity had gone overnight as passenger flights stopped operating, and many airports were totally disconnected from the rest of the world. Shipping lines were not able to call certain ports due to COVID restrictions. Borders were closed for cross-border trucking, and the list goes on. The pandemic has pushed supply chain to a whole new limit and challenged all models that are in place for prompt, safe, and sustainable distribution. Apart from painful public health implications, COVID-19 has actually crippled the economy with the lockdowns around the world. Speaking of healthcare logistics, the challenges were many, including safety of our employees, particularly the frontline workers, stock availability, cargo movement, and the capacity constraints, to name a few. Our organization has exhibited both resilience and adaptability. Our contingency response has primarily focused on teams' safety, and secondly, on ensuring uninterrupted supply chain to our customers. We have revalidated our service model to include a robust and a secure approach to storage and distribution, accommodating sometimes temporary space for stocking up, finding alternative freight options like running our own charters and full charters and part charters, but relying on our already tested and proven healthcare expertise, we have prepared for a vaccine phase. As global logistics provider, we think we have a huge responsibility on our shoulders for maintaining storage condition and securing validated cold chain across different geographies. And our team has revisited our cold chain management policies, processes, through prepared route risk assessments, qualified approved transport providers, and looking at out-of-the-box packaging solutions, and with a real-time smart visibility option. So it has pushed us into completely an innovation mode, which is on our footing. Our strength has always been creative solutions and profound expertise in healthcare logistics. For example, our real-time temperature monitoring capabilities, our integrated with supply chain solutions, and Hellman's control tower offering real-time intervention should any in-transit deviations occur. Route risk assessments precedes any solution design. We look at high potential sensitive port pairs, perform assessments, and lane qualifications performed. This is the basis of our risk management approach. That is so vital to the compliant execution in the healthcare supply chains. All solutions are available through our digital platforms. I hope I explained the question.
Yeah, brilliant. Thank you so much, Madhav. I can only imagine how challenging, of course, this past year must have been. But of course, that inspires innovation as well, doesn't it, as you mentioned. Dr. Pascal Reham, co-founder of the Group Medical Director of International SOS. Now, of course, International SOS has extensive experience working in challenging environments and locations. So how can your experience be applied in the current situation with regards to the provision of health services and specifically vaccine distribution, particularly to locations with access, infrastructure, or funding challenges there?
Good afternoon. And first, I would like to thank you for organizing such a summit, which I think is very important, and for inviting me to share International SOS experience. First thing, at International SOS, we strongly believe that the vaccination effort for a given country must be led by the local authority. However, the government resources in many countries are already stressed and challenged by the burden of COVID-19, and the government still need to address all other health issues. Therefore, what we recommend, and we have been able to work together with government in many countries, is a public-private partnership operating within the national guideline. We think that the private sector should be engaged to complement and relieve government effort. I will just give you two examples, which are happening at the moment, right at the moment. Since few weeks, the Republic of Papua New Guinea is facing a sudden, very, very sudden outbreak of COVID-19. The Australian government has offered some support, which has been accepted by the PNG government. And one of the priorities decided between the two governments is the emergency vaccination of the health worker of Papua New Guinea. To deliver this quickly, it's being done in a question of days. Efficiently, the Australian government has leveraged with the resource of the Australian private sectors, including companies like ourselves, which are already operating in Papua New Guinea. And therefore, in a real very short time, we have been able to start vaccination in PNG. Another example of public-private partnership, which is also happening at the moment, it's in Indonesia. I was there last week. The government of Indonesia, months ago, had made some agreement, especially with the government of China. They participate to the testing of some vaccine, Chinese vaccine. Thanks to this agreement, there are stock of Sinopharm vaccine available in the country, a new vaccine coming at the moment. The government of Indonesia has authorized some companies operating in very remote locations to access those stock of vaccine directly, as long as the vaccination will be provided free of charge to their employee, the family of their employee, and in some area, the local population living nearby the mine and the work site. Several international clients have engaged with this program. So at the moment, on behalf of our client, we have designed a program to deliver and administer the vaccine to those populations using our established work site health infrastructure and leveraging our existing community outreach program. The international SOS team, which were on site already, have been supplemented by other staff. They have been trained in a very short time to follow the international guideline and have been certified by the local health authority. As Madam just mentioned, our supply chain team have identified what we call the weak links in our supply chain due to the specific requirement of those vaccines, and we have reinforced them. In leveraging those existing human and supply chain resources, the mining company got the vaccine to their employee and family living in very remote location in a very timely and cost-efficient manner. And at the same time, it did not use public resources which are able to be focused on other areas of the country.
Dr. Pascal Rayam, co-founder and Group Medical Director of International SOS. Thank you so much. Great update there. Thank you. Well, as we've heard throughout the two-day summit, of course, we're experiencing pretty much the biggest global logistics challenge in history. And the Director General of the WHO yesterday spoke about, of course, the importance of coordinating a global response. So, Your Excellency, Dr. Harsh Vardhan, how do you see global powers coming together then to operate and supply vaccines worldwide within the current situation?
I think your initiative of Hope Consortium, I think it's a welcome initiative, and certainly is going to help shape the future policies in a much better way as far as you see coordination for vaccines, equitable distribution for the whole world is concerned. I think it requires a lot of awareness to be raised at all levels and discussions and debates because the World Health Organization is already trying hard. It started working long back on ensuring that there is a common platform to in fact help in research, help in vaccine development, help in validation, and then of course to ensure that all vaccine manufacturing countries of the whole world, they are on the same page, they are on the same platform, and then everyone is committed for equitable distribution of vaccines to every part of the world, to every country. And COVAX, through the COVAX facility, the World Health Organization is already trying quite sincerely and is in fact keeping in touch with all the countries of the whole world. Every Thursday there is a meeting whereby the whole world is updated and we participate in those meetings. So I think initiatives like the one that you have taken, they are certainly going to help and aid in the strengthening of this particular movement, because you see this is a crisis time. The whole world fought together COVID, and we know that the strategy for fight against COVID, including the final thing where we are trying to vaccinate people, it has been developed jointly by the whole world. Each one of our countries, we have learned from each other's experience. WHO has collaborated and ensured that there are, you see, national guidelines, international guidelines, and we work on those guidelines. We learn and improve upon what we are doing with each other's experience. And similarly, for the vaccines also, the whole process of its manufacturing, starting from development to manufacturing to its supply to the rest of the world, and then of course to ensure that they are finally delivered through the best possible cold chain mechanisms to the people of this world. It's all being, it has been a very huge exercise and very meticulously and very successfully done till now. And there is certainly a need for this whole exercise to be scaled up, and for people or for the countries where we expect more support for the rest of the world. That's what WHO has been expecting and demanding also. I think we need to keep reviewing, introspect, and ensure that every human being on this planet is helped. I'm sure that with efforts like this, they'll certainly be, we shall certainly be moving forward towards a good quality synergy and a good quality coordination and collaboration, which will ultimately help us in coming out of this COVID crisis in the whole world.
Thank you, Your Excellency. Yeah, it seems that collaboration really is the only way forward. Madhav Kurup, let's talk about the unique requirements of COVID vaccine transport, including but not limited to cold and ultra-cold storage requirements, for example. What do you see as the biggest challenges facing logistics providers and freight forwarders as you work to deliver vaccines, whilst at the same time monitoring and maintaining vaccine integrity? And what do you see as the biggest bottlenecks in terms of distribution, particularly when it comes to Asia?
Yeah, so we all are aware of the issue of accessibility to the COVID vaccines for all the citizens of the world still remain a concern. I think Dr. Pascal mentioned about what's happening in the rest of Asia, which is encouraging to hear. But we all know there are still concerns around there in certain countries when all of them will be vaccinated. But if you take Asia and Southeast Asian countries, I would still say there are still concerns there and the accessibility. I hope great initiatives like Hope Consortium and COVAX, like His Excellency Dr. Harshvardhan mentioned, is going to help in addressing those problems. We all know that no one is safe until everyone is safe. Just from a logistics point of view, I will maybe categorize a little bit down to cold chain management. Cold chain management of pharma products are not a new phenomenon for us. And we've been managing cold chain for pharmaceutical products under the same temperature regimes for years and decades in a very validated environment. So we already have a tested and proven global cold chain in place for pharmaceutical transportation. For example, we've been operating a hub in UAE through a validated process since more than 10 years, using Dubai as the hub for the rest of the region that covers Africa and the other Middle Eastern countries. The new challenge, however, in this case, is the capacity and compliance, to a certain extent, the cost as well. Also, the distribution process direct to the patient around the world without validation process of the route, and also without any existing data. That's a challenge. To establish a validated process to that scale across the globe in such a short span is a massive challenge. This requires partnership between various stakeholders and support the humanity without leveraging on any competitive advantages here. But we also need to look at the vaccine waste. I'm sure the minister will be very much aware of the issues, even in India, the vaccine wastage risk. With unprecedented pressure for mass production and distribution, we cannot afford a product wastage. Every vaccine shot wasted is a missed opportunity for inoculating someone else somewhere. With a high level of vaccine hesitancy persists in many countries, planning the right level of quantity for each location is the challenge. This results in vaccine wastage mainly due to lack of infrastructure available for return process management. Also, a regulatory and control mechanism in place to ensure proper destruction management, to ensure that wasted vaccine is not going into the wrong hands. Of course, the threat of counterfeit, there is also a higher risk of deviation and counterfeiting, requiring security solutions for serial numbers, tracking, and potentially using blockchain technology to track these serial numbers. We hear counterfeit vaccines are now sold online outside the authorized registered vaccine program. Also, threats of diverted products from supply chain, questioning their authenticity and storage conditions. So this is where the alliance like Hope comes as an effective model to address such challenges. We also know the other issue is the healthcare workers and the medical equipment availability. Apart from the challenge of availability of vaccine, in many areas there is a scarcity of resources in healthcare workers and syringes and medical supplies required for inoculation. And here, we cannot emphasize more on the need of support of NGOs as well as aid organizations. Governments cannot do everything. And NGOs have played an imperative role in history to fight earlier pandemics. This is no less serious than the previous ones. So aid organizations like Dr. Pascal's organization, SOS, offer important service and support in developing countries by providing medical staff and medical equipment to manage inoculation in these countries. So the challenges are, it's not really related to the actual supply chain management process. We are managing millions and millions of tons, kilos of pharmaceutical products in a highly validated and highly regulated environment around the world for ages for all of the pharmaceutical products. The challenge here is the capacity and compliance and some of the other things that I mentioned here about the wastages and how you defeat a counterfeit, and of course, availability of healthcare workers in certain countries around the world.
So interesting. Dr. Pascal Reham, I'd like to bring you in on this. So how would you advise to mitigate and manage supply chain risk for COVID vaccine distribution in developing countries then?
Okay, thank you. I will say first, I fully agree with what have just been said. What I would like to insist on is that the first thing is to get the dose into the country, and that's the main challenge. And I think, again, we believe in the power of public-private partnership. So let's see, the dose to arrive in a country, that is mainly the responsibility of the government, they will be the one who own and control the stock of vaccine. In some countries, they can be helped, and they will need to be helped by NGOs and other organizations. But when the vaccine are in country, they need to leverage, again, the private sectors to be able to achieve success with this unprecedented effort. And the first thing to do is just to identify who has existing expertise in this. Obviously, when you have companies in countries, a pharmaceutical distributor who has been distributing polio, flu, other vaccine for the past 40, 20 years, those are absolutely the ones who are the best prepared to adapt their supply chain and create a COVID-19 supply chain. So the first thing is really to look at who are the best prepared. And because we are in time of crisis, government may also look at maybe less obvious support. You have people expert in supplying perishable goods to the most remote area of a country. They have a great experience in managing cold chain. They may not be able to adapt immediately to the standard, but why not trying to work with them to see whether they can help? I will just take an example. A few years ago in Africa, a well-known soft drink distributor, likely the best known in the world, has been helping a lot in delivering bed nets to remote area for malaria prevention program. I'm sure that people who are able to distribute cold drinks and soft drinks or beer in the most remote area can help with the logistic of delivering, at least part of the logistic of delivering vaccination. So rather than overloading the government infrastructure, ask the private sector to help. However, and as Mr. Madhavkurup mentioned, it is absolutely fundamental for the government to establish the guideline, monitor the integrity and the quality of the vaccine and the delivery. If not, there will be a lot of waste and a complete loss in confidence.
Very interesting, and what an incredible update in terms of the logistics company that you mentioned. And obviously, yeah, it's better to expand on the efforts of those that are already on the ground, that are sort of used to this, and sort of, yeah, expand on their qualities. So His Excellency, Dr. Harsh Vardhan, so within India, what have been the biggest challenges that you faced in terms of rolling out the vaccination programs themselves? And what lessons have you learned that might be useful to other countries who are currently in the process of starting their own vaccination efforts?
Well, India itself, with a huge population of 1.35 billion, you see, anything that we plan and do, that itself is a big challenge. But you know that in India, while handling COVID, we took up the challenge head on under the leadership of our Prime Minister. And it was not only about the vaccination issue, also earlier, you remember that our first case was in January 2020, and this was declared as an emergency of international concern in March. We started preparing much earlier than that. Even on 17th of January, we had given detailed advisory to every state in this nation. And on 8th of January last year, we had, within 24 hours of the WHO's declaration of a COVID case in China, on 31st of December, we had our first expert group meeting, and then followed a series of steps whereby we created a movement of a sort where we in fact created all the capacity for testing, for laboratories, for drugs, for ventilators, for all related, whether it was testing, tracking, surveillance, isolation, quarantine centers. And then simultaneously because I am Science and Technology Minister also, we had in fact started working on the science around the control for COVID. And once you see the vaccine was, we could see that the vaccine was likely to emerge on the scene. 6 months back, detailed preparations for once the vaccine comes. How do you start vaccinating people? Being a huge country, and with, you see the amount of vaccine that was available and the amount of people who have to be vaccinated, then the challenge was how to start it. And then we prioritized our healthcare workers, we prioritized our frontline workers who were most at risk, and then of course those people above 60 and those with morbidities who were like the 80% of the people who who in fact lost their life during COVID were those in these age groups. So it was all had to be prioritized. And then for a huge country like this to have created and ensured that there is a perfect cold chain mechanism, although we have a huge robust universal immunization program whereby we vaccinate millions of children every day for 12, at least a dozen vaccines through the government of India. So all the upgradation of these facilities and then calculating and then creating 50,000 centers all over the country, and then it was like training almost 7 lakh workers who are involved in the vaccination of COVID. So building up this capacity, creating task force at multiple levels, at the national level, at the state level, at the district level, and even at the block level. Also it was a, and then to ensure that using the digital mode and creating the COVID platform, we can deliver everything in a seamless manner, and that we can right now ensure. And then of course there was this this moral responsibility of striking a balance between what we do for our own countrymen and what we do for the rest of the world. So under the leadership of our Prime Minister, this challenge also we could overcome, and we have struck a good quality balance between the needs of the world and the needs of Indians. And by prioritizing people in India, we have already, as I said earlier in the program, that we have already supplied vaccine almost 64 million doses to 84 countries of the whole world. So these were some of the challenges, but with a leadership of a dynamic leader like Prime Minister Narendra Modi, we could overcome all these challenges. And now on one hand we have successfully handled COVID with some of the best recovery rate in the whole world and the lowest fatality rate of 1.34%, and also in a seamless manner trying to deliver a vaccine to the people of India, everyone above 45 years of age. He can register himself through a platform, go to the nearest private or a government hospital. At a government hospital he gets vaccine free of cost, and then even if he walks into a center, and the number of such centers in the whole country is almost 50,000. So you can well imagine that in a vast country like India, there were challenges at every level, but we tried to handle each and everything most meticulously, most scientifically, took the help of professionals, took the help of the scientific community, and as much as we call the year 2020 a year of COVID, we also call it in India a year of science, because I have seen the scientific accomplishments of the people in India. They have done us so proud. So we strongly believe that if we try to involve the whole society, we try to involve the whole government and try to create a people's movement. That is what we tried to create in India for fighting COVID also, and now for vaccine also. We are trying to create a Jan Andolan. Now with vaccines, there are issues that cropped up earlier in the early stages of the vaccine delivery mechanism were about vaccine hesitancy and all those misinformation campaigns on the social media platforms, about which you see we had to encounter vaccine hesitancy, vaccine eagerness issues, etc., etc. But with good quality systems in place and diagnosing each and every issue very, very meticulously and finding solutions and actually providing treatment for those issues, we could ultimately overcome all these challenges. And we have in fact converted all these challenges and adversities into opportunities in India, and that's why we have been able to actually handle the whole issue quite successfully, we believe, till now, on both the fronts, handling COVID and also giving vaccination to our people to protect them for the future.
It really is crucial, to learn from each other, especially at the time at the moment. So thank you so much for your update on that. Madhav Kurab, tell us more about how partnerships like the Hope Consortium are effective in helping to support supply chain efficiencies and optimization in the global distribution of COVID vaccines. And what role does the UAE play as a hub for vaccine distribution across Asia?
Yes, if we had to applaud the leading position of United Arab Emirates and the consortium have played in fighting this pandemic. The vision has been domestic and also international. The consortium has really set a structure and drew an efficient path for management and distribution of vaccine. As we heard yesterday from the panels, from the chairman of the Department of Health and also from the Abu Dhabi ports, the vision is really to have Abu Dhabi as a license hub. And what is worth acknowledging is that this is not just a seizing ambitious opportunity, but most importantly, it is by large a collaborative humanitarian approach from UAE, attempting to support the neighboring countries. The consortium is playing an imperative role in managing complex logistics around vaccine distribution, ensuring safety and integrity of vaccine with a plan of around 18 billion doses of distribution in 2021 for different countries in need. Partnering with governments and NGOs and private sector, consortium has successfully pulled all stakeholders around the table and focused all efforts on combating COVID-19 rather than wasting time on competition and individual approach. I think you also asked the question on what is the UAE's role in this vaccine distribution. And managing a pharmaceutical cold chain hub, as I already mentioned, is not a new thing for UAE. It is actually a very well-oiled machinery. And it is easy to plug into this from a supply chain point of view very, very easily. UAE's vision and leadership position, in addition to the advantage of geographic location, the country plays an equally critical role in rendering UAE as a hub for vaccine distribution. The UAE's commitment to alleviate this pandemic is translated in efforts made to upgrade the supply chain infrastructure in terms of airports, seaports, and most importantly, the seamless documentation processes to transit to Dubai. UAE is a well-oiled machinery, as already stated. The capacity that UAE offers in terms of the airlines, lifting capacity from the vaccine-producing countries like India is substantial. The airline capacity out of India primarily driven by the UAE carriers for the rest of the world. And also the potential to move some of these products via sea in 2 or 3 days, or rather 3 or 4 days from India to Dubai by sea, and then again taking the massive capacity available in Dubai to the rest of the world is an immense importance to the whole vaccine distribution process. So I see UAE as have a major role to play in when the real distribution of vaccines start flowing all around the world from the pharmacy of the world, as I say, in India now. So it's going to be UAE can play a substantial role.
Dr. Pascal, so how exactly are countries investing in capacity building to best support vaccination program rollouts? And are there any regions in particular that are of a main concern as well?
Well, I think, as it's a little bit too early, we'll say, to make some definitive statement. I think it comes to an issue of having the fund, having the means to do something, and therefore the countries which are very much underfunded in public health today are the ones who are not doing very well with this crisis. I don't think, but what is encouraging is there are a few things that we have been able to witness. First, and thanks to the, I would say, digital technology, what we are seeing is that the information, education, communication, which has been used quite efficiently to promote during the past month the social distanciation, usage of masks, and all of this, the same resources are now being used to explain the promotion of and promote the vaccination and to dispel a lot of fake news. I was in Jakarta last week, and I'm impressed on how the message is getting through the population. I'm not sure it is the same in the country, but at least in the large cities, the education and the message is getting through, and you see the attitude of the population really affected by those messages. And I saw in another panel, there was a lot of question about how the population accept the vaccination. I can tell you what I've seen in Indonesia and in other countries in Southeast Asia, is that the vaccination, if people can get vaccinated, they get vaccinated, okay? What we are seeing also, which is encouraging in some countries, is that the public health infrastructures, which have been left under-resourced for so many years, some funds are now redirected to them. So we are seeing some money getting back to the public health infrastructure, which may not have been the priority for the previous year. In the private sector, and we are witnessing this with some of our international SOS clients, the corporation have increased the money that they are spending to support the health of their employee. And this money is being used very quickly. Those additional funds are being used very quickly to reinforce resources, which were already involved in some program. But thanks to this additional fund, we are able to create education about COVID and push the vaccination as well as other programs. But rather, if I may come back to what Mr. Kuruk was mentioning, I would say it's great to inject money, it's great to inject new resources, but there is a fundamental point that we need to be very cautious about, is to avoid wasting the dose, wasting the vaccine which are available. And so I will go back to the supply chain and having the proper process, this process needs to be supported by technology. So we need to have consistency in the information, consistency in proper data reporting. For every location, we need to assess the storage capability as well as the daily vaccination capabilities. This information needs to be made available to the central warehouse to make sure that one location is not overloaded with shipment. We have seen locations receiving shipment and the shipment were just wasted. So the last point, which has already been mentioned, we should not forget the importance of the training of the health professional. And rather than throwing health professionals, just let's train the ones who are available, are already on the ground, to make sure that they know how to use what will be sent to them.
Thank you, Dr. Pascal. Your Excellency, Dr. Harsh. Vardhan, back to you. I'd actually like to get back to this inspired initiative, the HOPE Consortium, which of course was founded to provide supply chain solutions to support the safe and efficient distribution of COVID vaccines. Do you feel that public-private alliances like this are timely in light of the global need to roll out vaccines to the global market?
Sorry, I couldn't follow your question properly. I think you probably asked me about the alliances that are taking place right now around this vaccine distribution. Is that the question?
Exactly. Private alliances, yeah.
Yes, you see, this is something which is a most welcome step, and I would like to congratulate the Hope Consortium, because this is exactly what is the need of the hour, and this is what organizations like yours are trying to actually contribute to the whole world. The World Health Organization does things at a bigger level, the higher plane, but ultimately the spirit of that alliance or working together, it has to be implemented at multiple levels, and multiple agencies, multiple stakeholders, multiple organizations, and multiple countries, and people with organizations with vision, the leaders, thought leaders, everybody has to come together and everybody has to contribute, and a synergy of the highest level has to develop in this whole world, where if we have to really fight COVID, and I strongly feel that COVID has taught many lessons to this whole world and we have learned to come out of the silos, we have learned to fight together, and when we are fighting together, we have been able to counter COVID in a much better fashion as compared to if we were not doing it together. So I think this is a welcome move, and this should inspire many others in the whole world, all those organizations and other consortiums who may not be right now focused on this particular aspect. They should all, for this crisis moment, focus on this aspect and contribute in some way or the other to ensure that there is a strengthening of relationships, there is a strengthening of strategy, there is a strengthening of joint strategy, there is a strengthening of movement around this fight against COVID, which should be aided and supported by everyone. So this COVID has brought forth for us all these alliances, and we are in the right direction. Now it is a question of ensuring that the spirit of the alliance is most honestly honored, respected, and implemented by each one of us all over the globe.
Thank you, Your Excellency. Now, sadly, we are running out of time, so I'd like to turn over to Madhav Kurab as we close the session. Please tell us your final sort of thoughts and the key messages you'd like our audience to go away with from our discussion.
Yeah, I know we are out of time, but I just quickly want to compliment Dr. Harshvardhan because I think the efforts the government and the leadership in India have taken is an example for the world, because when the whole COVID started, everybody was worried about what could happen in India, and how the government, the leadership, and all the citizens of the country have got together to counter this is incredibly a great achievement, and I hope it continue to be that way. The key challenges for the vaccine distribution, as I mentioned, is cost, capacity, and compliance. So in a highly diverse world with the complex regulatory processes and infrastructure challenges and expertise challenges, it is highly critical that any organization which has the knowledge and ability to integrate end-to-end solutions with the full visibility will help vaccine producers to ensure product integrity until it reaches the patient. So it requires alliances, partnerships, and the engagement of governments, NGOs, the private sector, and the experts to resolve gaps and hindrances of the movement of vaccines and clearance and documentation processes that should not be a bottleneck. So all this put together, we can solve the threat of this pandemic and hopefully get back to normal life pretty soon.
Thank you, Madam. For Dr. Pascal, your final thoughts and key messages for our audience, please.
So, sorry to repeat myself, and to repeat what the other panelists have mentioned, I think the key issue for the Asian country is to get the vaccine, to get the dose. So every effort and all those group effort, COVAX, orders are absolutely essential to make sure that the country can get their fair share of the vaccine. What we are seeing as a responsibility of the private sectors, where we cannot do a lot in getting the vaccine, where we can really help is making sure that when the vaccine are there, the vaccine are not wasted, and the vaccine are getting to the people who need them in the most efficient way. We have seen also that the new technology, digital, can help considerably in training, improving processes, and we need to absolutely digitalize all those supply chain, all those information, all the data reporting, again, to make sure that we are making the best usage of the vaccine, which will be made available to each and every country.
Thank you, Dr. Pascal. Your Excellency, Dr. Harshvardhan, I'd like you to close our session, if you may, with the key messages that you'd like our audience to go away with from our discussion.
You see, my very small message would be, you see, when we were fighting COVID last year and when there was no sight of the vaccine on the scene, I used to tell my own fellow countrymen that don't bother so much and be desperate about the real vaccine. You already have a very potent social vaccine in COVID appropriate behavior. This mask is a most potent vaccine. The social distancing is a most potent the social vaccine. And then, of course, hygiene around your hands, sanitizing your hands, etc. So the COVID appropriate behavior was the most potent social vaccine, which is equally powerfully important even now. And now when the vaccines have come on the scene, they are being delivered to the people. The message for the whole world is that let us develop a Jan Andolan, people's movement around these vaccines, where we should all pledge to ensure that there is equitable distribution of vaccines and we are able to provide vaccines ultimately to people all across the globe, and also not forget under any circumstances COVID appropriate behavior, which continues to be the most potent tool to fight COVID at the moment. So that is, I think, the message that I would like to give in brief as a closing remark for this discussion.
Thank you so much, Your Excellency, gentlemen. As mentioned, public-private partnerships, reinforcing existing infrastructure, careful analysis, as you mentioned, and identifying weak spots are just some of the vital components mentioned in our discussion today, as we depend on each other for prosperity and as we build on an inclusive recovery going forward. Ladies and gentlemen, that brings us up to date with vaccine production and distribution across Asia, a very detailed and impactful discussion there from our panelists who really have given us a truly unique insight, an update in our last and final panel of the day and of the entire summit. It really has been so interesting to hear from you all and what needs to be done. We do have to leave it there, sadly, but thank you ever so much once again for being with us here today and for sharing your thoughts and advice so openly with us. Thank you so much.
Thank you.